Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and here is what we have for you all from the world of medicine. How these glomerular kidney diseases lead to cardiovascular diseases. It is a known fact that patients with a chronic kidney disease are known to be at high risk of cardiovascular disease also. Cardiovascular disease risk in patients with primary glomerular diseases is very poorly understood because these conditions are quite rare and they always require a kidney biopsy for their particular diagnosis. Very little is known about the risk of cardiovascular disease in such patients. Hence, in a recent population-based study on adults with primary glomerular disease, the researchers described the risk of cardiovascular disease when compared to the general population and also studied the impact of traditional as well as kidney-related risk factors on cardiovascular disease risk. The study that I am talking about is published in the American Journal of Kidney Diseases. Here, the rate of cardiovascular events in around 2,000 Canadian participants with biopsy-proven IgA nephropathy, minimal change disease, as well as membranous nephropathy was 2.5 times as high as the general population and was also high for each disease type. Consideration of disease type, kidney function, and proteinuria, all these improved the prediction of cardiovascular events in such patients. Therefore, to summarize, the population-level study, it showed that patients with a primary glomerular disease definitely have a higher cardiovascular risk and that the inclusion of kidney-specific risk factors may improve the risk stratification. How exercise can help fight against the pancreatic cancer and boost the immune system. Aerobics as an exercise has always helped us to reprogram our minds, also our immune system. And this has shown to even reduce the pancreatic tumor growth, thereby amplifying the effects of immunotherapy. The study is published in the Cancer Cell Journal and it provides a new insight into how the body's immune system, which is designed to attack the foreign invaders like bacteria, can also evenly recognize the cancer cells as abnormal. The exercise induced, it increases in levels of the hormone adrenaline that causes the change to the immune system, including the activity of cells that respond to the signaling protein interleukin-15. The current study found that exercise does promote the survival of CD8 T cells that have been sensitive to IL-15 and also doubles the number of them, which is often homing to pancreatic ductal adenocarcinoma tumors. Now, such effector T cells have been shown by various other studies to be capable of killing these cancer cells. Other tests found that aerobic exercise for a 30-minute period 5 times a week did reduce the rate of cancer formation by 50% in pancreatic ductal adenoma carcinoma cases and reduced tumor weight by 25% in the other group. Hence, the authors concluded that aerobic exercise does affect the immune microenvironment within pancreatic tumors. That is capable of detecting most cases of neonatal jaundice that might be of great help in middle-income countries. According to a new study, a smartphone app that identifies severe jaundice in newborn babies by scanning their eyes could be a lifesaver in areas that lack access to expensive screening devices. The app that is called as a Neo-SCB was developed by clinicians and engineers and was used to screen for jaundice in over 300 newborn babies following an initial pilot study on 37 newborns at the University College London Hospital. For the large-scale study that was published in Pediatrics Journal, the team tested over 300 babies with the app, which analyzes the images taken on the smartphone camera to quantify the yellowness of the white part of the eye, which is the sclera, which is a classical sign of neonatal jaundice. Now, analyzing the yellowness of the eye just by looking is very unreliable, and the Neo-SCB app can give early diagnosis of neonatal jaundice requiring treatment. The study compared the effectiveness of this app with the conventional screening methods, and of the 336 babies that were tested by the app, 79 were severely jaundiced newborns and the app correctly identified 74 of them. This is in line with the accuracy of the most common conventional screening method, which is a non-invasive device known as the transcutaneous bilirubinometer. The transcutaneous bilirubinometer works by screening the yellow pigment under the newborn's skin to give a measure of jaundice levels. All the screening results are then followed up by blood tests to determine the type of the treatment which is further required. So with this app, screening will definitely be much faster and reliable. Drug that is called Everolimus, which is commonly given after resection of kidney cancer. In a study of patients with high-risk renal cell carcinoma, those who took the drug Everolimus daily for up to 1 year after their surgery lived longer without their disease returning than those who did not take the drug. Now, improvement was seen primarily in patients with very high-risk disease, while patients who had an intermediate risk disease saw no improvement as such in their recurrence-free survival. The results are taken from the Everest study that was presented at the 2022 annual meeting of the American Society of Clinical Oncology. The Everest trial that I'm going to talk about today enrolled patients who had been diagnosed with intermediate high risk or very high risk renal cell carcinoma, and all those who had their cancer surgically removed by a partial or a radical nephrectomy. The study randomized close to 1,545 patients. Of these patients, to a year of either Everolimus, a 10 mg pill which was given daily, or a placebo which was starting within 12 weeks of their surgery. The Everest patients with very high-risk disease who took the drug saw 21% improvement in the recurrence-free survival, whereas the recurrence-free survival for essentially unchanged for those in the intermediate group. Adverse effects also, such as oral mucositis, led many patients to discontinue the treatment in between. While on the Everolimus arm, 37% of the patients stopped their treatment because of adverse events they were constantly experiencing. In fact, only 45% of the patients in the Everolimus arm completed all 54 weeks of the study treatment, compared to 69% in the placebo arm. The researchers noted that in spite of more dropouts, they still observed favorable results for Everolimus, which brings into question the duration of adjuvant therapy that is actually needed. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.